For decades, the World Health Organization and the CDC have relied on the same broken strategy: mass testing, quarantine, and lockdowns. These measures destroy families, bankrupted business, and nations while failing to stop transmission. But there is a better way: the Dr. Maya strategy, and the science proves it works. For the past decade, the WHO and CDC championed one idea: test everyone, isolate positives, force quarantine, knowing the test results are not 100% accurate, and lock down the rest. This approach has three fatal flaws. First, false security. Mass testing creates an illusion of control. False negative patients spread infections, and so tests are imperfect. People who test positive today may not be symptomatic or infected. We cannot test your way out of transmission. Second, economic devastation. The 2014 to 2016 West African Ebola epidemic led to lockdowns that caused economic collapse. It led to healthcare breakdown and secondary deaths from malaria, TB, antimicrobial infections, and maternal complications. Testing cannot feed communities nor cure infections. Third, stigma and loss of trust. When authorities force mass testing out of fear, people hide their symptoms. Cross-infection occur at testing area, hospitals, and labs. They avoid clinics. The epidemic goes underground. The answer is early identification of the sick, not the worried well. Targeted protection of the vulnerable, not mass lockdown. Individual risk assessment, not population-level fear. This is Dr. Maya. Teach communities to recognize 4 cardinal signs of Ebola: fever, muscle pain, weakness, and headache. When someone shows these signs of infection, identified as blue in the Maya framework, Maya will offer empathetic advice, saying, "You may be infected, so please isolate to protect your family now. Doctors will call, and help is on the way." Kindled by emotions, it will make the user follow the instructions. Maya suggests not enforcing. This is the power of Maya. Local healthcare workers will be informed to help mobilize care. No unnecessary testing of the well, forced quarantine, or lockdowns. The evidence is overwhelming. Barbier et al. In The Lancet. Early community identification of symptomatic individuals reduced transmission by 67%. Frieden et al. In the New England Journal of Medicine. Targeted isolation achieved disease control with 81% fewer secondary cases. Kohler et al. Population-wide lockdowns increased psychological distress and, paradoxically, increased transmission through unmonitored networks. Why does WHO continue recommending mass testing if evidence is clear? Institutional incentive. Testing infrastructure is a $12 billion global industry. PCR machines and reagents are all justified by testing assumptions. If WHO admits symptom recognition works better, that infrastructure loses justification. Lockdowns are politically easier than nuance. Vaccines become the default response rather than one tool. A strategy based on individual risk assessment doesn't require mass vaccination. I have no objection to testing or vaccination, but they must serve a strategy built on prevention and protection. The Dr. Maya framework does this: color-coded risk assessment, early identification, targeted isolation, protection of the vulnerable. The Congo does not need more testing capacity. It needs 1. Community education for mothers and fathers to recognize signals. 2. Local healthcare worker mobilization, community clinics empowered to diagnose, isolate, and provide care. 3. Barrier protection, plastic sheeting and training for families isolating symptomatic loved ones at home. 4. Transparent risk assessment, no stigma, clear guidance, empowerment. The Dr. Maya AI healthcare ecosystem is built for this. The technology exists, the evidence exists. Public health institutions must trust communities to protect themselves. The next Ebola outbreak in Congo will not be controlled by WHO. It will be controlled by mothers who know the signs, by families protecting each other with simple barriers. Prevention is not testing. Protection is not lockdown. Empowerment lasts. I'm Dr. Kadiali Srivatsa. This is the future of global health. Will the WHO listen before the next crisis, or continue to cling to power and destroy the lives of millions by 2050? The choice is yours. Like Albert Einstein said, the world will not be destroyed by leaders, the WHO, or the greedy hoarders of wealth, but by people like you who surrendered your free will and watched them without doing anything. Thank you.